Thank you, Broadcasting. We are back in session in the outcome 2 of families and communities, and in continuation of our questioning. And Senator Little, you have the call.
Thank you. Commissioner Hunter, congratulations on your role, and I've got some questions for you if you can assist me with those. There are already Indigenous specific Children's Commissioners in the ACT, Queensland and South Australia and Victoria. And I know specifically in Victoria and South Australia the number of children in out-of-home care continues to go backwards. I'm wanting to understand, I know you've only been in the job a short time, but what will be some of your first tasks to ensure that there is no duplication in the work that is done? And the second part of that question is, how can you actually intervene in outcomes for those states and territories in a national role?
So one of the, Sue Ann Hunter, National Commission for Aboriginal and Torres Strait Islander Children. So the role of the Commission is not intended to overlap with other commissioners. It's to stop our kids falling through those gaps that are there. Part of the role is to collaborate and coordinate, which have already started. So the Australian and New Zealand Children's Commissioners, Guardians and Advocates have a group. So I'm co-chair of that. We've already met once and we're meeting again. And so looking at national priorities together and what that looks like. Where everybody recognises the urgency for our children, as we all do. How we bring that together and get our priorities right as a group is really important, and where we look at what services are working. So it's not just all, the bad stuff that's happening. What is working and why is that working? And then how do we, within those regions, does it need to be duplicated as well? How do we hold accountability for things that aren't going right? What does that look like? And as you know, we've got legislation, hopefully it gets passed, that will help us coordinate better and be able to bring together all, I guess one of the things I really want to look at is data. And as you've pointed out, 2 states. What does that look like at a national level? And it's collected differently within each state, territory and jurisdiction. How can we bring that together so we have a really fulsome look at what is going on within every state and territory? I think we really need to look at what's working and then where are the gaps within that.
Okay. Have you thought about how you might deal with conflicting advice? Because you might have commissioners and they're all structured slightly differently, but you've also got conflictors, these commissioners butting up against governments of all different persuasions.
Yeah, that's correct.
And they haven't had much progress in getting the change that's necessary in those numbers.
Yeah, I will say when we come together, so we're about to have our second meeting, we really want joint priorities of we know the overrepresentation in every jurisdiction is quite bad or severe at this point. So how do we come together and pick those priorities? And that will help inform part of the work that I do. And also where there isn't, we'll lean into each other's powers and sort of help each other of how we get movement. At this point, I don't actually see the conflict with the jurisdictions. Everybody sort of knows their own backyard. So what is it that they need done in their jurisdiction and how can we work together? And they're really supportive of this role and we've had lots of conversations already.
Right. I just want to ask you about the terms of reference for the organisation and for your role. The research, advocacy and providing advice already exists there. I'm interested to understand, based on the terms of advice, and this might be a question for the department even, what is it that the Commissioner will do that isn't already provided by the department? Because you have a list of people that you're required to consult whenever you do programs and initiatives. I'm just trying to actually see the evidence of the separation of those responsibilities.
Jacqueline Rouse, Group Manager, Family Wellbeing. Thank you, Senator. I think there's a couple of things there. One is the National Commissioner is independently resourced to undertake consultation directly with children and young people. That's a significant part of the cost base, and that was appropriated in this last budget. So that's a significant resource for the Commissioner. There's also the practicalities of the Commissioner having those relationships with community and having probably more legitimacy to talk directly about subjects that, you know, maybe they don't want to talk about the department with. The other thing I would say is that some of the proposed powers in the legislation do go to that ability to request information from other parties and to also publish when those people are not going to provide that information, and that is something that, you know, doesn't normally fall within the department's responsibilities. We wouldn't proceed in that way.
I'm still trying to understand the responsibilities of the department on consultation and how they will be different to the responsibilities of a Commissioner for consultation, because you do have youth advisory groups, you've got people that you can access, and we would expect you to talk to.
Absolutely.
How do we make sure that we're not all talking to the same people on the same issues just at different times?
Yeah.
In terms of reference, make sure that that doesn't happen.
Can I just, if you don't mind, I'll step in. One of the things that we've already started looking at is we know that it's quite siloed across the government of children, and they're sort of in every portfolio. How do we bring them together? What do we look at, all the frameworks, all the work that's currently happening, and how do we bring that together is one of the pieces of work that I really want to look at. The other piece of work that I really want to look at is I want to bring together all the reports that are already done. There's hundreds of recommendations across states, territories, nationally. How do we bring that together, look at what's been implemented for our kids, what hasn't, why, and really do that piece of work. But I want to work across all departments, not just DSS, but all departments, and bring some streamlining for our kids. And there might be things that are overlapping that we can really say, hey, let's bring this together. What does that look like? So we've got better outcomes. Spoke to NIA the other day about when we do go out, or they're going out, about how we contact each other so we're not bombarding our youth with a lot of questions and overburdening them, and not doing something new to add to the burden of our children, which they already carry. How do we do this? And so I really want to coordinate that across everywhere. And I want to work across all governments to make sure that there's good outcomes for our kids.
Right. People often report consultation fatigue, so I just want to stick on that at the moment. How do we make sure that that doesn't occur and continue?
I think one of the things is I don't want to start new youth groups or new consulting parts. I really want to go, we've started reaching out to communities and mapping where there already are those groups of children and young people. Said to NIAA and DSS, when you're going out, can we have a look at how we can bring this all together as a day for our kids, and not just about consultation. Is there other stuff we can do with our kids, and information sessions, and really make something of where they're learning as well as not. I'm very aware that we take a lot from communities. How do we give back in those moments as well is really important.
Yeah. Commissioner Hunter, when you last appeared at Senate Estimates, you had only 5 weeks in the role. You said that you were making sure that you were talking to children and young people, setting up a robust framework and a child-safe framework that was trauma-informed, culturally safe, and meeting kids where they are, so that they were able to talk to you. At what stage is that framework at now? That's
still being done at this point. And once that is done, I actually want to talk to a sort of older youth group and really get some input on them. I just want it to meet kids where they're at, and I want to make sure that we're doing it properly, and you know that it's right. The last thing I want to do is re-traumatise kids. So I don't have a time frame on that at this point. I think most of our efforts have gone into legislation, setting up the office, getting staffing, all of that. But that's underway, and I want that to be well done and executed, be able to be executed really well.
Right. So you've been in the role, I think, since September, is that right?
Yes.
Right. So how many times have you met formally with the Minister for Indigenous Australians?
I have not met.
Right. Not yet?
Not yet.
Not yet.
I do have one coming up.
What about Minister for Social Services?
Twice.
Maybe
Right.
3 times, maybe.
Twice.
Right. What about the Assistant Minister for the Prevention of Family Violence?
Twice.
Twice. And the Special Envoy for Remote Communities?
No.
Marion Scunville?
No.
No. Okay. I want to ask you a question about the prolific use of social media by Aboriginal youth, and I've raised it several times. Have you had any input into the government's social media plan on the disproportionate impact of social media on our children because of their prolific use of it?
I think that was the timing of I arrived after that was implemented, but I did speak to that commission and we're catching up in a couple of weeks.
All right, okay.
Yeah.
So you're
Yes,
planning
I
to
do.
talk to Commissioner Cronin and
Yeah.
others more formally?
Yes.
Okay. Commissioner, you would be aware that in 2022 the Albanese government abolished the cashless debit card in sites around Australia. Have you visited any of those CDC trial sites, or are you planning to do that? And I ask you that because not a single child was given a voice in that document that actually asked about the impact of the removal of those cards.
We plan on going out soon once our powers are in place and we've got our funding, and we plan on going everywhere to speak to as many children. So we would be in those
look
areas.
At those specific sites, Sejuna, Kununurra, those places.
We can do that.
All right, I would really be interested in what you see on the ground in terms of that impact. Have you actually got a schedule to visit those, or are you just kind of thinking that that's where you'll
We
go?
are bringing on an engagement officer in the next couple of weeks to look at community engagement. We have been invited to the Torres Strait and Palm Island, going out with the Queensland Commissioner. So we will be setting the sites soon, but I'm happy to include those sites.
I think they're essential to include
Yep.
personally. There's been some studies and some reporting about the higher numbers of gaming machines per capita being located close to Aboriginal and Torres Strait Islander communities. Is there any chance you can go and visit some of those places where that's actually occurring, where there is actually an issue of significant issue of gambling addiction in those communities?
Yeah, I think the part about planning ours is where the most need is, and that would obviously be part of that need to go out there, but there is no reason we can't do that.
I asked a question before about payments to children who are no longer able to stay with their parents and a culture of reunification. Will you be taking an interest in how we make sure that, I know that child protection is the responsibility and administered by the states and territories, but there are connections. Would you be trying to explore how we create a culture of reunification where it is safe to do so right across the points at which those children come into contact with the system, and even if it is from a payment perspective, because I do hear from people that they feel that sometimes that doesn't happen as fast as it should because there's a financial benefit in those children remaining away from the families.
And Senator Little, my background is social work and working directly with our kids, and I've seen where kids have come into care and payments haven't gone over to the carer, or they've left care and then back to their parents and payment. I think it's a really, and I heard your question earlier, and I think reunification should be planned straight away once a child is removed. How do we reunify? So I'll be definitely looking into those areas.
Okay. All right. The Commission reported that of its 6 performance targets, only 3 were achieved, or 2 were in part. I'm trying to work out which Commission this is talking about. Maybe my questions. The Commission has a substantial budget. Have you worked out how you're going to actually spend it?
So what we need to do is start our planning, which we've started doing. I think the first thing is we only currently have 7 staff, so looking at our staffing and what we need in what areas, of course, planning that research project. One of the other things we really want to look at is data and how it's collected. So we need to really lay the foundation, and I think once that's laid, I think a lot may go on in the first year of actually going out to communities and talking with kids and looking at issues, talking to the orgs. It's not only that, it's talking to everybody, because it's everybody's business and everybody should be involved in our kids' welfare.
These are probably questions for the department. I'm interested in understanding, references say the Commission will support all closing the gap targets beyond supporting them. What specific quantifiable KPIs has the government set for the Commission itself?
Senator, the government won't set the KPIs for the Commission in that way, because they are a fully independent entity. But I do think Sue-Ann has, the Commissioner, has referenced her particular interest in understanding the drivers for the targets, particularly around out-of-home care and youth justice. But Commissioner, did you want to add to that?
No, I think...
Will you set your own... Will you set KPIs? How are you...
I think we've got to look at... my key priorities are out-of-home care and youth justice. That's where we're not making any inroads, and that's particularly the places... that's partly the reason the Commission's set up, children being removed and being incarcerated. Looking at what are those drivers and looking at something different of how we intervene within those systems. And I think it's great that we look from a systemic level, which is what we're set up to do, because then we can actually inform policy, the systems, and then how that reaches the ground is really important for those programs. I think if we get it right, the system right, it will inform and help support the programs to get better outcomes.
So reference materials have stated that feedback talked of reform, but I'm interested to understand what does that look like when we're talking? Will you be based in Canberra? Is that
I'm based in Melbourne. I have a staff member in Wagga. I have some staff in Canberra, and we're about to have some staff in Queensland as well. I think having if we're going to be national commission, we need a national footprint, and we need people to be able to respond to each state and territory as we go along.
Right. 76% of Indigenous youth under supervision had interactions with child protection. Does the government believe that public advocacy and providing advice is actually enough in terms of and sufficient tools in order to make a difference in that area?
Sorry, Senator, can I clarify the question under whose supervision? Sorry. Okay.
We've got significant numbers of kids that are entering child protection. I want to understand, because a part of that role, a big part of that role is public advocacy and providing advice. I want to know, do you really think it's sufficient tools to break that cycle for the Commissioner to actually really start making inroads in that area? If that is public advocacy and providing advice.
Well, it's important, isn't it?
Isn't that what you do?
We also have a responsibility in the policy space, and we are at the present time working with states and territories around specifically the closing the gap targets that relate to young First Nations children. So, Commissioner Hunter has a role to play, and so do we.
So, who's under the terms of reference and how this is structured, whose advice takes priority? I mean, who has great access to the Minister in order to provide that advice about out-of-home care, children in detention?
Well, it's not a binary. It's not a question of who has precedence. Clearly, the Minister, having met with Commissioner Hunter, places a premium on her advice, and the department also provides advice to the Minister, and and sometimes that happens together. So it's not a binary. It's not an either-or thing.
I think the other thing is about working together. We know there's so many silos, and that I think that it's not working. Like, it's just not. It's getting worse for our kids. And the one thing I don't want to do is have this commission work in silo. We can work across governments and bring everything together for our kids. It's about capability of being able to do that. And I think together, I just believe there's in numbers together working, we can actually make some inroads. I've spoken to health, I've spoken about housing, and how do we bring all these together? Because we've got so many plans for our kids and everyone's competing, but how do we bring it together? Because our kids are dying. How do we bring this together so we can make really good outcomes that have our kids surviving and not attending school or not going into, youth detention? And we together need to figure this out because, as I said before, I may be the commissioner, but it's everybody's responsibility to make sure we have better outcomes for our kids. And I always say if we get it right for Aboriginal and Torres Strait Islander kids, we've got it right for everybody. And I think we need to work together. And we've all been really clear sitting at this table that that's what needs to happen.
The reason why I'm trying to understand this is we've seen the alcohol restrictions that were lifted in just after 2022. It was pretty obvious what was going to happen there. We saw the cashless debit card ending. It was pretty obvious to people what was going to happen there. We've seen the targets in Close the Gap go backwards since 2022 in those 4 areas that are worsening. We know that the Northern Territory has been hit significantly hard by those numbers, and that's one of the places that is significantly skewing the data. So that's why I'm trying to understand whose advice is going to be prioritised here.
So that's your view. I mean, I don't know that we would necessarily share your view about that.
Well,
so,
which bit?
I mean,
the data, because the evidence is there.
Well, I'm not sure we share your view about what's happened and why we have out-of-home care rates, because the out-of-home care rates are problematic in states places outside the Northern Territory. So, it is. There's more going on than just that in our minds, but. The Commissioner Hunter will provide, a really valuable view and bring her experience to help the challenge we've got to turn those Closing the Gap targets around. The department is working very hard in this space as well. And so this idea that who takes precedence, I think is a false argument. Like, the Minister ultimately is taking both sets of advice and is well and truly capable of synthesising that. But we're doing our best to work with Commissioner Hunter cooperatively too. So I don't see that I don't understand the issue, that's an issue.
Well, we'll see that as it plays out. I'm finished with that line of questioning. Thank you.
Thank you.
I've got questions for AFES, if they're available.
Yes. Australian Institute of Family Studies. You can continue your call. Senator Askew has some? I haven't got it. No. Okay. Yeah, you'll continue to speak.
Thank you. I'm interested in, hello, thank you for being here this late. AFES is currently running a deficit of 1.129 million. Can you tell us why that's the case?
Thanks for the question.
You in a report.
Thank you, Senator. Catherine Addison, Acting Director for the Australian Institute of Family Studies. In terms of the current loss, currently, because since the annual report, our current net cash operating loss is running at about 3.1 million altogether. There's a range of different factors that have contributed to that. Predominantly, it's been a slower pipeline of projects coming in. There's been some delays to the projects in the current financial year that are creeping into the following year. And there's also been just some changes with the staffing that have gone on at the same time as well. So it's broadly the factors.
Okay. Is there anything in relation to management that has led to that rapid deterioration in that financial position?
Actually, I'd probably say that there's been some strong developments in the last sort of 6 months in particular, last 12 months, where we've been really looking at realignment within the organisation and thinking about the sustainability in terms of the longer term. So a couple of things have been our release of our strategic research agenda last year, which has really set the scene for focusing us in on what we should be doing. And then coming off the back of that, our realignment work that's looking at what's a financially sustainable position going forward on the basis of the type of projects that are going on, the length of those projects and the staffing profile that's needed for those projects.
Your contract liabilities have significantly increased. Can you explain why there's been such a huge increase in that?
Which page are you referring to?
Contract liabilities on page 60.
Page 60.
This suggests that you've increased from 8.6 million to 14.6 million.
Here we go. Oh. Sorry, Senator, I'll have to take that one on notice. It could be that there's some fieldwork costs in there. We have fieldwork peaks and troughs with some of our studies, so I'd need to take that one on notice.
The next question relates to, and it could help answer that, talks about your win rate in relation to select tenders. It was 71%. In relation to open tenders, it was just 14%. Could that be a contributing factor?
It's actually a different, that's a different situation. So one of the things that we've been looking at in the lead up to last year was the mix of projects that we've been focusing on. And since then there's been a focus to shift to more of our direct funding, so direct approaches to potential funders, and that win rate's considerably higher. So it's rebalancing where we put our effort in terms of the projects.
Right. Can I ask you about the government social media ban? Were you consulted on that? And did you provide any advice to government on that?
Not specifically in terms of advice. One of the things that I can say is that we're supporting the E-Safety Commission in terms of their data-related work and undertaking some data linkage functions for them. Okay.
Just in terms of your public engagement targets, your media mentions growth rate was 1%. Which missed its target of 10. Media requests for comment growth rate was 34%, missing the target, the 10% target. Oh, sorry, minus 34%, missing the 10% target. What are you going to do to correct that?
Well, actually, I can say that at the moment we've just been tracking our progress this financial year, and we're on track for all of our targets bar one, which is that competitive tender process, although we're talking a much smaller number this year.
Thank you. I think that's all the questions for you. Thank you.
Thank you.
In the 2025-26 portfolio budget statement, where is it that we can locate the programs and administered items specifically funding technology facilitated abuse responses?
I'll see if we've got our financial people with us.
Thank you.
Yeah, I'm not sure there's anything in there. We might need to take that on notice, Senator. Okay. I'm not sure that there is a specific line item related to technology facilitated abuse, but we'll take it on notice and come back to you.
I'm also interested to understand for 25-26, 27-28 milestones, has DSS committed to technology facilitated abuse outcome improvements, and how do they align with the AIHW dashboard releases?
I think we should take that on notice.
Yeah.
Do that as well.
Thank you.
All right. In terms of the training target, this is probably from Ms. Lutz, the training target that's outlined in the first action plan for technology facilitated abuse, competency training across frontline workers. Can you tell me how that's going? Have you met those training targets?
Senator, Anna Lutz, Group Manager Family Safety. We'd have to take that one on notice, Senator, and come back to you. We certainly have a lot of frontline training happening across different sectors, so we just need to have a look at the sub-measure and come back to you.
Yep, and if you can tell me where
Yeah.
you're actually at,
Yeah.
not you just haven't mentioned that you have met them or you have met them, where it's actually at. I just want to ask about the Commonwealth Ombudsman's weaponisation of child support, if we can go back to that. Which of the Ombudsman's 8 recommendations have been fully implemented by the department? I think you did that. You did that before, yes.
Yeah, we did.
I think I asked that question before. Sorry.
You can stick it on notice if you like.
No, that's all right. I remembered it when I saw it. I thought, hang on, I know the answer to that.
I answered it as well. It's been a long couple of days.
Okay.
It has been a long day.
I just want to ask about technology and connected cars. I am interested in understanding about what specific regulatory levers, consumer law or privacy laws, telco standards or procurement requirements have been able to be altered in order to improve technology, or reduce technology, facilitate abuse and coercive control using vehicle technology. Is that you, or is
it's not, Senator. So this is work that's being led by the E-Safety Commissioner, and so those legislative frameworks sit outside our portfolio.
Okay. Okay. I think that might actually have pretty much. Healthy Mate Prevention Program. Given DSS's central role in coordinating primary prevention activities under the National Plan, what transition arrangements does the Department have in place for that program?
Thank you, Senator. We'll just ask Ms Hurley to answer that question.
Thank you.
Thank you, Senator. Emily Hurley, Branch Manager, Family, Domestic and Sexual Violence Specialist Policy. Can you just repeat the question?
Yeah, I'm interested to understand with the Healthy Mate program, what I'm trying to get to is how much engagement was actually done by those schools in the transition of that program to understand gaps between that and the Healthy Mate, what they had in place in Healthy Mate.
What?
Senator, can I just clarify? Healthy Mate's still in place. They are
Yeah.
undertaking work now, so there's been no transition.
Right.
Those programs are still running.
So there's no change to those programs?
No,
Right.
they're still running, yeah.
Okay.
So yeah, there's 3 programs, 3 providers within that Healthy Mate program, and they're continuing.
Because the information I had was that some of those schools that actually had programs, particularly for boys and focused on boys, were impacted by the changes in the Healthy Mate program.
Oh,
And
I'd
you're
have
saying
to
that's
take that on
probably not
notice. Yeah.
the case. Right.
That might be within the individual 3 providers, Senator. We'd have to take that on notice if there's been changes to the schools
Okay.
that have been in.
Thank you. And
Senator, sorry, just to add to that, we might we're very happy to take further information just to understand the circumstance so that we can come back to you with a more relevant response too.
yeah, okay. All right, I will do that. I want to understand about innovative perpetrator responses. 20 projects have been approved, which include 6 scoping studies, 12 trials and 2 combined scoping studies and trials. Of the 12 trials, I understand 4 are still in the early stages of stakeholder engagement and procuring models. How come those are still in the administrative phases? Because we've been talking about innovative perpetrator responses for quite some time.
Yes, thank you, Senator. I'm just checking. I might just ask Ms Bureau to join us. We might just be able to give an update where they're up to, just in terms of progress. I think there has been some progress since.
I think Senator Eve Cordero, Branch Manager, Family Safety, Anna, I think we'd need to take that one on notice, Senator.
Oh, okay. All right, I'll do that. Can I ask you, we saw this week Our Ways, Strong Ways, and obviously that was, a standalone plan was initiated under a previous coalition government where nearly 4 years, and it's true that I've heard multiple times from people about disappointment in that time frame that has occurred between when it was first, the idea was first mooted and the actual plan. Can you tell me, when I was looking at that plan, I was trying to work through it. It seems to be a plan to make another plan because it talks about developing a strategy We had 4 years waiting for this plan, but when I was reading through it, I was trying to understand. It kept referring to a plan that was going to be done.
Yeah.
So how is it not a plan to make another plan?
Our Ways, Strong Ways, Our Voices has been developed, including with the steering committee and with really extensive consultation, as I'm sure you're aware, Senator, but with a view to a 10-year strategy for reducing violence for Aboriginal women and children and their families, and has, because it is a 10-year strategy, and again similarly to the other longer-term strategies, the expectation is that there will be short-term action plans that relate to specific efforts and actions to implement that. The government, in launching Our Ways just this week, has also announced initial investment. And so that's kind of early investment that will precede work on the first substantive action plan as well.
I noticed that there were case studies where various people were spoken to about what they would like to see. Is it what they would like to see because they refer in there to this being endorsed by the government, or is everything that's actually in there that is referenced in the case study endorsed by government? I'm just trying to understand, is this how much of that plan is going to be implemented?
Well, the strategies, the plan has been agreed by obviously the Commonwealth Government, but also by states and territories as well. So it is, and developed obviously through the steering committee in particular, leading that work. So it is holistic in the sense that all governments have agreed to sign up to the strategy that's outlined in there.
But Senator, it's $218 million of a new investment in Aboriginal controlled specialist domestic and family violence services nationally, as well as an extension of the Leaving Violence Program regional trials for First Nations people. So there's a very practical frontline core to this plan. So, I mean, all those other things are true, but the frontline service delivery by Aboriginal controlled organisations for First Nations people.
But is it only by them?
Sorry?
Is it only by them? Are they the only people that are going to benefit where in places where there are not the services currently that exist to support people? Surely you're not just going to fund Aboriginal community controlled services that don't actually have a service delivery print.
There's already a national service system, specialist family and domestic violence service system. This is a First Nations augmentation of that.
Yeah, but what I'm trying to understand is some of the references in there, including there's a reference in there to making funding for mainstream services contingent upon mandatory decolonisation training. Is that fully endorsed because it's in the plan? And what does that mean?
So obviously the strategy has. Are you referring to a case study in there, Senator?
I am.
Yeah. So the case studies obviously reflect perspectives that have been brought in the development of the plan. The substance of the plan itself has been endorsed by all state and territory governments and of course by the Commonwealth as well. The investment that the Secretary has just referred to is targeted to Aboriginal community controlled organisations, but exactly as you say, obviously the government's made significant investment, particularly in specialist family violence services, largely through, I think the Minister referred to it earlier, but largely through the states and territories who lead on specialist service response, and of course many of those services both some of them are specialist organisations that are Aboriginal community controlled organisations, but lots of them are mainstream organisations that obviously also support First Nations women and children, for example.
All right, so I made reference to, before having a look and being a little confused about the talk in the plan about a plan. When are we going to see the action plan? Is there a timeline that's not going to blow out to 4 years for that?
So we're progressing immediately with that initial investment. So we're not waiting for a plan. And part of the initial work, in addition to the initial investment, is also to confirm the governance arrangements for the development of the first action plan. So that is something that is very immediate and something that we're immediately working to progress.
Okay. Thank you. Thank you. That finishes the questions for me. Thank you, Chair.
Done?
That's it.
That's it. Great. Thank you very much, everybody. That concludes today's hearing, and I want to thank all the witnesses who have appeared and to Hansard and Broadcasting for their assistance. I remind senators that the committee has agreed that any written questions on notice should be lodged with the Secretariat by Thursday the 19th of February 2026, and that answers to questions on notice are due by Thursday the 9th of April 2026. The committee stands adjourned.